Hello everyone, welcome back to Myhem. Today we are diving into herpes virus or herpes simplex virus, HSV. So the first section I will talk about herpes simplex virus 1 and herpes simplex virus 2. They are both alpha herpes virus family DNA virus that establish lifelong infection in human, but while they are genetically similar, they behave quietly different in body. Herpes simplex virus typically associated with oral herpes, and herpes simplex virus 2, they are more commonly linked to genital herpes. So one of the most fascinating aspects of herpes virus is their ability to go latent, meaning they hide in nerve cell and reactivate later. Herpes simplex virus 1, it's hide in the trigeminal ganglia, which is near to the face, and herpes simplex virus 2 prefer sacral ganglia located near to the lower spine. So the reactivate can cause, pain and vesicles, fluid filled with blisters, and something called, viral shedding, which means the virus can spread even without visual or visible symptoms. So diagnosis of herpes simplex virus by PCR testing, detecting the, viral DNA with high accuracy, viral culture, growing the virus in a lab, and OFA, which is likely referred to oral fluid assay or an invasive method. So while there is no cure, antiviral medication can manage symptoms and reduce, outbreak like acyclovir, valicyclovir, and famiciclovir. So prevention is a key, especially since herpes simplex virus can be transmitted even when symptoms aren't visible. Education, firstly, to know the facts and reduce, the stigma. Safe sex practices using protection and communicate with partner. OFA, again, likely referring to oral fluid testing for early detection. So nextly, I will talk about human papillomavirus. Isn't just a virus, it's a group of over 200 related virus. Some types cause, harmless skin warts, while others are linked to the serious condition like cervical cancer and head and neck cancer. So low risk types cause genital warts like human papillomavirus 6 and 11. High risk types linked to cancer, which is human papillomavirus 16 and 18. Human papillomavirus is primarily spread through skin-to-skin contact, especially during sexual activity. It's so common that nearly everyone will get it at some point in their life, so often without even knowing. So can be transmitted even when asymptomatic. Condoms reduce risk but don't eliminate it. So most human papillomavirus infection are silent. They go away on their own. But when symptoms do appear, they might include, genital warts, abnormal Pap smear result, and pre-carcinous change in cervical cells. So detection method could be Pap smear for cervical change and human papillomavirus DNA test to identify high-risk strains. So the really where science really shines, it's human papillomavirus vaccine are incredibly effective. Gardasil 9 protect against 9 human papillomavirus type, including the most dangerous one. And recommendation for boys and girls starting at age 9, also approved for adult up to age 45. So add to that should be regular screening, safe sex practices, and public awareness. So next I will talk about cytomegalovirus. Cytomegalovirus is one of the herpes simplex virus. Why it's a beta herpes virus and infect people of all age. Most healthy individual won't even know they have it also, but of certain groups, cytomegalovirus can be life altering. So it's a double-strand DNA virus, as I mentioned, establish lifelong latency in the body and can reactivate when the immune system is weakened or suppressed. So cytomegalovirus is spread through body fluid like saliva, urine, blood, breast milk, and even sexual contact. So common in daycare settings and among young children, and can be transmitted during pregnancy, leading to congenital cytomegalovirus. This is where cytomegalovirus really get serious. If a pregnant person contact cytomegalovirus, the virus can cross the placenta and infect the fetus, leading to cause of non-genital hearing loss in newborn, and can cause also developmental delays and vision problems and seizures. So early detection and antiviral treatment can help, but prevention, is the key. In health people, cytomegalovirus often cause no symptoms or mild flu-like illness, but in immunocompromised individuals like transplant recipients or people with HIV, it can cause, retinitis, pneumonia, hepatitis, gastrointestinal disease. Diagnosis, by PCR testing, cytomegalovirus antigenemia, say, and serology like for IgM and IgG antibody. Cytomegalovirus doesn't have a cure, but it can be, managed with antiviral like Cidovir and Ganciluvir, prevention like hand hygiene and avoiding contact with saliva and urine and for young children. So now I will talk about Epstein-Barr virus. Now, Epstein-Barr virus is also, gamma herpes virus, and it's human, also called human herpes virus 4. Is the one of the most common virus on the earth. It's over 90% of adults have been affected to some point in their lives. They are also double-strand DNA virus and establish lifelong latency in beta cell, and can reactivate silently to cause, disease. So also, Epstein-Barr virus is spread mainly through saliva, which is a nickname. That's why they call it kissing disease, But it can also spread through sharing drink and blood transfusion, organ transplant, and sexual contact. So the most famous illness caused by Epstein-Barr virus is infectious mononucleosis. It is common in teens or teenagers and young adults and can cause fatigue, fever, sore throat, and swollen lymph nodes, enlarged spleen, and liver. So recovery results take from 2 to 4 weeks, but fatigue can linger for months. So diagnosis of Epstein-Barr virus tricky because symptoms mimic other illness, but tests include, monospot test for mono and Epstein-Barr virus antibody panel for IgM and IgG, PCR testing for viral DNA. So also, there is, when Epstein-Barr virus gets serious, it's linked to several cancers and immune disorders like Burkitt's lymphoma, nasopharyngeal carcinoma, Hodgkin lymphoma, post-transplant lymphoproliferative disorders, which is a PTLD. And so also, there is no vaccine for Epstein-Barr virus, no specific antiviral treatment, but, management focus on rest and hydration, pain relief, and monitor of complication. Prevention tips: avoid sharing drink and also practice good hygiene. Be cautious around immunocompromised individuals. So, okay. Next, I will talk about Epstein-Barr virus. It is mostly through saliva, and it's called I mentioned it's that it's kissing disease. So also I will talk about varicella zoster virus. It's cause for chickenpox and shingles. We are diving into this virus. So it's the double-strand DNA virus from the alpha herpes virus family. Same as herpes simplex virus 1 and herpes simplex virus 2, but varicella zoster has a unique trick. It causes two distinct diseases depending on whether it's your first encounter or reactivation. Primary infection is the chickenpox or varicella, and reactivation is the shingles or herpes zosters. Chickenpox is usually childhood illness marked by fever, itching, rash, and fatigue and malaria. And it is spread easily through respiratory droplets and contact with lesions. The incubation period is 10 to 21 days, and it is highly contagious. About 90% of close contact will get infected if they not immune. So now we talk about shingles. It's year or even decades after chickenpox. Varicella zoster can reactivate as a shingles and cause painful blister rash, and also often affect the face and eyes, and can lead to post-therapeutic neurology and chronic nerve pain. So risk increase with age and stress or weakened immunity. Shingles isn't just uncomfortable; it can be really serious, more serious. So doctor diagnosed varicella zoster using clinical science like rash pattern, PCR testing, or viral DNA. Serology for antibodies. Treatment include antiviral and prevention all the time is a key. Varicella zoster vaccine for children is important, and also shingles vaccine, which is a Shingrix for adults over 50. It's really crucial. So vaccination is highly effective and can prevent both chickenpox and shingles. So now, lastly, I will talk about HHV6 and also HHV7. They are both herpes virus family, and they are they call also roseola virus changes. Also, they are, we will talk firstly about HHV6. It has two types, 6A and 6B. 6A less common and more neurovirulent, linked to autoimmune and neurological, and B it's more prevalent, cause residual infantum, or as I call it, 6 disease in infants. So transmission is spread via saliva, respiratory droplets, and possibly vertical transmission from mother to fetus. Nearly 90 to 95 of people are affected by age of 3. Clinical manifestation for HHV6B: high fever, rash, febrile seizures in infants, and HHV 6A associated with multiple sclerosis, chronic fatigue and syndromes, and Hashimoto hidradenitis, and the gliomas, lymphomas, and infertility via infections. So latency and reactivation: latent mononucleosis cells and brain tissue can reactivate in immunocompromised patients, causing encephalitis, pneumonitis, and bone marrow suppression. So diagnosis by PCR testing for viral DNA, serology for IgM and IgG, and specialized dermotrial testing for HHV6A in infertility cases. So treatment: there is no cure, but antiviral could help, like algancillovir, and vaccine research still not yet especially for HHV 6B, it's underway. So HHV7 is a silent convention, an overview discovered in 1990, closely related to HHV6, and affect CD4 cell, often acquired in early childhood. Transmission primarily through saliva. Nearly 95% of adults are seropositive, and symptoms often asymptomatic or mild, can cause residual like illness, fever, rash, vomiting, febrile seizures, encephalopathy, hepatitis, and Rett syndrome. So complication may reactivate Epstein virus and linked to transplant complication and neurological disorders, and possibly dementia. So PCR testing for HHV7 DNA and serology for past exposure. Treatment: no specific antiviral therapy, and supportive care like monitor in immunocompromised patient. It's important. Thank you for listening, and this is the last